Hi, everyone. Hi, good afternoon. Hi, I'm Robin from SSR. Thank you all for joining us today. As I scroll down the attendance list, I'm heartened to see many familiar names, participants who have joined us for our first webinar in September, our second one in October, and our third one today. At SSR, when we first conceived this COVID-19 webinar during the circuit breaker, um, uh, the intention was to showcase research on the impact of the pandemic on the lives of the vulnerable and response of social services. We weren't quite sure if we could pull it off, let alone put together a series. Our key concern is, do social service agencies have the resources and bandwidth to conduct research during these exceptional times? However, we were encouraged to know that amidst helping the hardest hit and the most vulnerable, a handful of social service agencies started to conduct research alongside delivering their essential social services. This started as early as during the circuit breaker, and more joined the bandwagon over time. This is evident from SSR's current run of the research mentoring program, where a handful of social service professionals are conducting COVID-19 related research in their respective agencies. These agencies have understood the importance of collecting data in a systematic way so as to better understand the communities they work with, and with the aim of channeling support to the most vulnerable, as well as to advocate for the new and emerging needs arising from the pandemic. Today, we are wrapping up the webinar series with two presentations. First, the findings from the COVID-19 Social Data Bank. This study was conceived by my colleague at SSR, Qiyan, whom I remember was very quick in assembling a team in May to study the impact of the pandemic on social service clients and professionals. At the same time, Adriana, our second speaker for the day, together with a team from AMKFSC Community Services, were conducting learning conversations with over 200 clients on how they can come together to support the community during this crisis. Now, let me welcome our moderator for today. She's Anita. Anita is a senior director with Touch Community Services. She oversees the Touch Integrated Family Group that provides resources and support to families. In addition, Anita has set up Touch's Impact and Research Department in 2017. This has enabled the organization to measure outcomes and better communicate their impact to stakeholders. I shall now hand the time over to Anita. I wish you and the speakers have a fruitful dialogue with our audience today. Thank you.
Thank you, Robin. And a very good afternoon and a warm welcome to all participants and all of you who have tuned in. Congratulations to the Social Service Research Center on your 5th anniversary, and thank you for having me as the moderator for your final webinar. My name is Anita and I am from Touch Community Services. Today we are looking at, hang on, let me just, okay, I will have to ditch the script and do justice to the two speakers that we are seeing today. We started COVID, the first case of COVID on 23rd January. And then we went through circuit breaker, we went through phase 1, we went through phase 2, and now we are awaiting phase 3. So in the phase 3, we don't know when that will happen, but we are hopeful that it can happen by the end of the year. And we are thankful that things have calmed down for Singapore, and we hope that it will continue that way. Before we invite the speaker, I need just two administrative matters. While the speakers are presenting, can we request that you mute your mic while the presentations are going on. And you are most welcome to send in your questions to the Q&A box. But when you send in a question, could you help us to put in the presenter's name in front of the question? The presenter will then, we will then assign the question to the presenter accordingly, so that it's easier for us and we can save time. And also, if you feel that your question can be answered by both presenter, please put the word both in front of your question as well. So we will now bring up the very first speaker. Today, the presentation will talk about the COVID-19 impact, the circuit breaker on the vulnerable communities. We have already witnessed and experienced the unprecedented challenges in both form and magnitude of the circuit breaker, including loss of income, the heightened level of stress, and family violence. The presentation today will also give us an understanding of how individual Singaporeans can come together to design solutions in a very organic way for collective well-being. I will now introduce our first speaker. I was just joking with the speakers. I don't know who is more nervous, the moderator or the speakers, because I hope I make sense of their presentation. But I will bring up now Dr. Ong Qiyan, a new friend that I recently made. She is the Deputy Director of the Social Service Research Center, and she specializes in using behavior and applied economics to study individual decision-making and the effects on performances, and the effects and performances of different policy programs. Her work includes studies on debt in low-income families, transnational marriage support programs, and incentives on motivating pro-social behaviors. As Robin mentioned earlier, today Dr. Ong will share with us her work on the COVID-19 Social Data Bank, which was designed to help us understand the impact of the COVID-19 pandemic on social service clients and professionals. Without further ado, I will pass the mic over to Dr. Ong Qiyan. Qiyan, please.
Hi, everyone. Okay, I'm not sure how many of you have followed the Social Service Research Center's COVID-19 Social Data Bank. As Robin has introduced, the Social Data Bank was started in May. So once we went into circuit breaker, a team of us decided to quickly, put our heads together to document what is going on in the social service sector, and also to provide timely feedback for the social services to think about, to look out for trends and to look out for clients who may be in need. Okay, so first, let me start by thanking 117 contributors from 14 social service agencies who have helped us in this data collection effort. It was a very difficult task for them because they had to be on the front line, serving the clients and helping everyone in need, and at the same time contribute to research. So we, the whole group of us, we really thank all these contributors for their generosity. Yeah. Just to share with you how the data bank works. So we invited social service practitioners on our mailing list to register as contributors on 5th May 2020. And the data collection started the next week. Okay, so it was, we continuously invite social service practitioners to contribute data. And so throughout the entire period, okay, so the number of contributors change over time. For representativeness, each social service practitioner will contribute data on the first 2 clients that they spoke to on an assigned reporting date. And they can contribute 0, 1, or 2 cases each week. Okay, so based on this, we construct what is representative of what is happening in the social service sector in each week. And then from there, we provided information output in the subsequent week, okay? On average, social service practitioners contributed 9 cases over 12 weeks, as you can see on the chart on the right. Okay. The social service practitioners were very compliant. So most of them reported cases that they have spoken to on the reporting day. So this assures us that the data is fairly representative. FSC social service practitioners contributed the most data in the sample. So it forms about 73% of our weekly sample. Non-FSC cases included cases managed by different charities, organizations with targeted services, but each organization contributes a very small fraction of the sample. The presentation today will be based on the data from FSC SSPs for the ease of understanding. Okay, so that we will not worry that the trends that we are observing are skewed by certain participation of certain agencies. Okay. For those of you who are new to these projects, we have shared 12 weeks of infographic based on the data collected, spanning across different topics. So this information are available on our website, our Facebook page, and our website, okay, listed here for your reference. Okay, so after 12 weeks of infographic, here I am trying to give you more information about what we have learned during the circuit breaker period. Okay, so the areas of focus today for me will be on families with young children, as well as financial assistance coverage during the circuit breaker period. Okay, so the motivating question is this: how were families with young children affected during the circuit breaker period? So we knew that there were major disruptions during the circuit breaker. There was school closure. There was a scramble to implement home-based learning. School holidays were brought forward into May during the circuit breaker. There was restrictions in childcare arrangements. Okay, so closure of childcare centers and difficulties in transporting children between homes and their grandparents' homes, and so on and so forth. So all this disruption should have affected households with young children. Okay, and so the question is, how did it affect them? And some types of households more affected than others that we should be paying attention to. Okay, so this is the focus of this very small part of the presentation. The data was collected during the circuit breaker in the last 3 weeks of the school holidays. So we did not have any information before the school holidays during the home-based learning period, which by now all of us would have agreed that it was a very, very busy time for everybody. Okay, very difficult to get the resources together. So this is during the school holidays, and then how and what happened during this period, and how families cope post-COVID when schools gradually resume. Before I share with you the findings, let me first caveat this presentation by saying that I'm going to put forth some questions rather than answers. So these are basically areas that I think going forward we may need to pay attention to, but not necessarily answers to any questions here. Okay, so it's more research will be required. Okay, so the first thing that we observed was that family violence was much higher across all types of family during circuit breaker. I have broken up the families into 3 types: renters with young children, low-income owners, and higher income owners. And the reason for doing this is that we know that there are income differences may have contributed to the ability to cope with childcare. We also know that housing size may be very restrictive, especially during circuit breaker when everybody has to be at home. So this is the reason for looking at these 3 groups separately. And again, just to reiterate, family violence was higher during the circuit breaker for all 3 groups. Okay, so that was a real concern, and I think our social services have tried their best to help all the families, and I think it's a fantastic job. In terms of trend, we should observe that family violence fell very quickly once we went into post-CB period. Post-CB phase 1 is when the schools started reopening and on an alternate week basis. Okay, and post-CB phase 2 is full reopening. So you can see that school reopening was actually critical in reducing the family violence rate. Okay, it is highly correlated with the rate of family violence. Apart from that, we observe that something special about these low-income owners with young children. You see that they are more likely to report emotional distress during the CB period compared to the other two groups. Okay, but this also curbed right after the circuit breaker ended. Now let's look at the profile. So if you think about, okay, so is it just a very small group of people that are experiencing issues? Okay, so you know, especially the low-income owners. If we look at the proportion of owners and renters with young children who sought help, we see that okay, this is the proportion of owners with lower income with children of different age groups seeking help. Okay, so this is how we read the chart. So you can see that when after the circuit breaker ended, households with young children are less likely to seek help. Okay, so there is a drop in the proportion of households, low-income households seeking help with children seeking help post circuit breaker. Okay, but the same trend is not observed among the renters. All right, so this again poses the question. So what is causing this dip and what is causing this to be stagnant? Okay. Next, we also look at the absolute numbers. If we compare the low-income owners and the higher-income owners, you can see that the lower-income owners who sought help were more likely to have children aged below 12 and below. Okay, during the circuit breaker period, given by the red bars. So you see that these two bars are much higher than this. Okay, compared to the renters, the proportion of households with children aged 1 to 7 is approximately the same, but low-income owner households with young children are much more likely to seek help during the circuit breaker period. Okay, so this is 18% more than the renters. Okay, so what could have explained the difference in the proportion of low-income owners and renters with young children who sought help during during the circuit breaker period? The differences have disappeared right after the school reopening. Okay, so you can see that the orange bars are comparable right after school reopening, and then the yellow bar is also comparable. Okay, even so the direction has changed somewhat, but it's more or less the same. So this stark increase in the proportion of low-income households with young children, owner households with young children seeking help, what could have caused this? Okay, so I don't have the answers now, so this is for us to discuss and think about. What we can tell is that the employment or employment arrangement during the circuit breaker do not seem to explain this difference. Okay, yeah. So some food for thought for this part of the presentation. Okay, so we have seen that school closure and the lack of childcare had very severe impact on families with young children. It led to family issues, a spike in family issues. It led to a spike in family violence. Family issues means family conflict in general. So we see that the stresses brought about by school closure and the lack of childcare were shared by renters and owners. It's also shared by low income and higher income clients. Okay, so it's not unique to a particular group. However, we do see that compared to renters, low-income owner households seem to be more affected, okay, especially those with primary school-going children. So this leads us to think about this gap, right, in two ways. Okay, so is it the case that low-income owner households with children, did they receive similar levels of support as rental households with children during the circuit breaker? Based on my understanding, there were a lot of support that was provided during the circuit breaker period by social services. So I heard from social worker friends that they prepared little goodie bags of little games, card games, family interaction material, just to keep children occupied at home during the school holiday and the circuit breaker period when they couldn't go out. So were the same level of support extended to lower income owner households? I'm asking this only because low income owner households may be difficult to spot because they live among us in HDB flats and not in pure rental housing blocks. Okay, so which are much easier to distribute resources. Okay, so this could be one reason. The other reason is that were the rental households more used to having children at home and were better able to cope during the circuit breaker period. Okay, so this suggests that rental households were more resilient in certain sense. But this resilience, while we applaud this resilience, I worry about the availability of childcare support for renters during normal times. Okay, so it's quite likely that low-income owner households had relied a lot on childcare support and the schools to take care of their children during normal times when they work. But rental households may not have the luxury of doing so, and hence they are more used to having children at home. Okay, but this leads us to think about childcare support for renters during normal times. Okay, so this is two areas that we have to I hope to hear your feedback about. Okay. Next, I'm going to go into the role of financial assistance during the pandemic. The pandemic has this feature that that the key feature of this pandemic is that individuals have lost a lot of control, okay, over what they can earn, especially because of the major disruption to certain industries such as tourism and F&B. So if you happen to work in those industries, your income is highly affected. There is some disruption in demand. So for example, during the circuit breaker period, nobody goes out. So Grab drivers are affected. Delivery drivers, however, will have increase in businesses. Okay, and there is also mobility issues. So the limited savings among the low income in particular will affect the decisions, their decisions in terms of food choices, arrears, and borrowing, which will have long-term impact. Okay, and there are also many studies that showed that sustained long-term exposure to stress from managing income volatility will threaten mental health. And we could see that worldwide, there is a huge spike in mental health, emotional distress among people. Okay, so this means that certainty in assessing financial aid will be especially important as during this period. Okay, and more so for the low income. So how much certainty did our financial assistance schemes provide for those who are facing financial challenges due to the COVID situation? Okay, so very briefly, this is a chart to show you the financial assistance coverage between May to July, our data collection period. And you can see that during the circuit breaker, about 70% of the clients who reported having financial difficulties received some formal assistance. Okay, and this number increased to close to 80% by July. Okay, so there is actually an increase in the number of people receiving financial assistance, which is very heartening to know. The main sources of financial assistance, at least in our sample, was government FA and SSAs provided FA2, okay, during this period to their clients. Okay, self-help group and other kinds of financial assistance account for a very small extent, okay, of the group. Okay, the main thing I want to share with you is this slide, which is that the left slide, the left chart shows the financial assistance coverage for renters, and the right shows the financial assistance coverage for home owners with PCI less than 650. So these are low income owners, okay, but they are by income standards, they do qualify for financial assistance, but of course our financial assistance schemes could have other considerations. Okay, so we see that the coverage for renters are very high, above 80%, but of course there are still leakages. Okay, people who may be waiting for FA, or or are not eligible for whatever reasons. So I want to bring your attention to the role of SSAs in supporting these families. You see that for renters, SSA support 6% more families, rental families, to have financial assistance, whereas they supported 24% more low-income home owner families to have financial assistance during July. Okay, in July. So this is a very huge portion. Okay, so it's about half of what the government is providing in terms of accessibility, not magnitude. Okay, so if you look at this, you can again see that during the circuit breaker and post circuit breaker, basically the government assistance have started to decline. Okay, the accessibility, so the proportion of people having it has started to decline. But when we add, when we count whether the clients have access to SSA, FA, the numbers actually rose. Okay, for low-income clients versus, and it moderated a little bit for those higher income ones, but basically it was kept about the same magnitude. Okay, so because of this, the strong support of SSAs, basically SSAs have stepped up to make up for declining government financial assistance coverage, okay, during the post-circuit breaker period. Okay, so some food for thought. Financial assistance in Singapore remains very much means tested during this period, and even though it's supposed to reduce income volatility, but means testing actually adds to the uncertainty. Okay, so we see that some people do not have access to financial assistance, but of course it could be a matter of time. Yeah. The good news is that SSA have stepped up on their FA disbursement as the government FA declines, especially for owner households. Okay, so this means that they believe that longer or more FA is necessary to help clients stabilize further and rebuild their buffers. It also means that that there is a belief that the support should not be just for the poorest households, but also the higher the ones in better financial position. Okay, so for example, there is a huge support for low income owner households. Okay, so I guess that's the intention is to prevent them from rapid deterioration in terms of mental health, family relations, and finances. Okay, so these are some considerations that SSA seem to have shown when they are deciding on FA disbursement. Okay, so this brings to the question: while means tested FA may reduce the moral hazard and reliance on social support, it also means that help is most available when one is most down and out. Okay, so we saw that the government FA was highest for the renters, second for low-income households, owner households, and lower still for higher income households. Okay, so it means that for a higher income households to eventually access FA, it could mean that this household may have to deteriorate even further before they start qualifying for financial assistance. Okay, so then this becomes a very remedial kind of approach. So how do we balance a preventive kind of approach that SSA seem to have been taking, the approach that SSA have been taking, which is to support not just the poorest, but also higher income households? And does it mean that we should consider a more comprehensive social insurance scheme during the pandemic or even the normal times? Okay, so I leave this this question for your thoughts and comments. Okay, so that's all for my presentation. Thank you very much.
Thank you, Qiyan, for the comprehensive presentation on how circuit breaker affected the low-income families in terms of childcare and financial aids. What especially caught my interest was the difference between the renters and the low-income house owners and how they were very differently impacted. So maybe later, if there is a question related to that, we can also discuss more. As a reminder, you are invited to send in your questions into the Q&A box if you have any. As you do that, let me now also introduce our second speaker, Ms. Siti Adriana binti Muhamad Rasip. Adriana is a community worker with Ong Qiyan Family Service Center. Her key belief is that the community is enriched with assets, and the community is able to come up with solutions for collective well-being. Underpinned by the asset-based community development framework, the COVID-19 No-Threat Learning Conversations by AMKFSC aims to understand both the challenges faced by and assets of beneficiaries during the circuit breaker. This presentation will shed light on the major findings from these conversations with more than 300 beneficiaries conducted by the team. Let us welcome Adriana. Adriana, please.
Hi, okay, thank you, Anita. Hi, everyone. Let me share screen. Okay. Okay, hi everyone, I'm Adriana. I'm from AMKFSC Commmunity Services Limited. My work is mainly based in the Family Service Center. So the community that I work with is mainly with low-income communities. So today I'll be actually sharing with you more about an initiative that the agency has taken, which is called the COVID-19 No Sweat Learning Conversation. So I'll just go into it. So maybe I just have a roadmap of what I'm going to share for today, so as to give you all an overview of what I'll be sharing today. So I'll be starting with introduction objectives of context of how the COVID-19 No Sweat Learning Conversations came about, and then give you guys share summary of the findings that was obtained from the conversations. The responses that took place in response to the findings that were discovered through the learning conversations, as well as a few key reflections for social service practice for us to ponder upon beyond COVID-19. So actually, what I'm going to share today, it can actually be summarized in the letter A, not for my name, Adriana, but okay, if I can explain to you the framework. On the left, you see through the learning conversations, we find assets and resources, and on the other side, we also find out about the challenges that beneficiaries and families are facing during this period. And you see the thing connecting the assets and challenges are the responses, which bridges both assets and resources. So from all the experience of discovering and also responding to the information that's uncovered from the learning conversations, it all culminated to a few key reflections that we can learn. Yeah, so this is just a framework, a visualization of what I'm going to share for today for your benefit. Okay, so move on. So COVID-19 learning conversations. So why learning conversations? Learning conversation is actually a concept in the asset-based community development approach, where one actually adopts a very curious stance about the other person, learning about the other person's assets, the other person's strengths, what the other person is passionate about. And we've actually contextualized this concept to the COVID-19 pandemic to actually understand what are the situation of beneficiaries and low-income families during the COVID-19 period as experts of their own lives. So we want to understand, we want to take a curious stance to really understand what's happening on the ground. It's also, the objective is also to discover assets and community resources or initiatives that can be mobilized to meet challenges faced by families during this period, as well as to also inform creative interventions to address challenges and harness resources during this period. So how was the learning conversation done? done, volunteers and staff were mobilized to conduct check-in phone conversations with a total of 349 beneficiaries living in Ong Qiyan. So these phone conversations lasted for at least 20 minutes. So it's quite a comprehensive conversation with a list of guiding questions. This learning conversation was actually carried out in 2 phases. There was one phase where it was before pre-circuit breaker period from February to early April 2020, and another wave of learning conversations during the circuit breaker period from April to end June 2020. I also would like to give a caveat here that the learning conversations were not really designed for research purposes, so the findings might not be as nuanced, as comprehensive as Qiyan, but it actually presents a very convenient information and data sample that gives us insights of family situation during the COVID-19 pandemic. So in a nutshell, the ongoing research is actually the ongoing learning conversations, the things that we uncover from the learning conversations, and these actually present emergent and real-time challenges faced by the families and also assets that we use to inform the action and interventions and responses, be it from the community or be it by the agency. So that's the research that's done, research for action. So now I'm going to present a summary of the findings in terms of the challenges. So out of 349 beneficiaries that we have learning conversation with, 34.4% of them reported facing financial challenges. And this actually was from a loss of employment. A couple of them had loss of employment and then they see a decreased income. There was also beneficiaries also see like an interim period where they're waiting for financial assistance, and during that period they were really in a period where the finances were very tight and they had little to tide through the period. Some of the beneficiaries also saw their Comcare assistance being reduced and being insufficient during this period, while at the same time being ineligible for schemes like TRF, the COVID-19 support grant. So they had to grapple with the loss of assistance during this period. Some of them said also that government payouts right now, government payouts that were given throughout the period was actually insufficient to cover the increasing expenses from staying at home, because they spend a lot on food and the utility bills are also increased from long periods of staying at home during circuit breaker. 24.9% reported employment-related challenges, which is a loss of income due to being put on no pay leave or decreased work demand or closure of companies. It is actually very pertinent and prominent in industries such as retail, transport, and hospitality, an area of work industries where a lot of our beneficiaries are working in. Some reported a loss of side income, which is actually significant in supporting and supplementing the family's main income. So housewives who do home-based businesses, home-based cooking or home-based baking also saw a decrease in orders, and thus they are also not able to get the income that will go into supporting their families, which is very significant. There's also beneficiaries also face a situation where they are in a precarious, uncertain job continuity position, because while they are on no pay leave, the employers do not give them a definite answer whether they are also able to return to work after the circuit breaker. So there's a lot of anxiety that they have to sit with. For those who are already unemployed or lost their job and finding employment, there's a lot of difficulty in trying to find employment during this period, and thus they cannot earn an income for their family. There's also an intersectionality between employment and also citizenship. There was one beneficiary who said that her renewal of LTVP was contingent on whether the employer would actually allow her to go to work after the circuit breaker period. And this actually caused a lot of anxiety, because if the company closed down, then those who don't have citizenship will be the first one to be let go. So that was kind of the anxiety or the stress that some of the beneficiaries were facing. Some also because they had caregiving challenges because of taking care of kids at home, they are unable to also find employment. About 40.6% reported psychological emotional stress from juggling all the multiple stresses in the family, about tight finances, added caregiving responsibilities with children at home, and also guiding their kids in home-based learning. So anxiety and worry from seeing the number of cases rise and fear of contracting virus, and also stress from getting used and adjusting to new norms such as wearing the mask, having to do safe entry while entering supermarket. For 35% of them actually reported food insecurity, which is a lack of access to food supplies or groceries due to either tight finances or food running out of stock at the supermarkets. Remember, there was a period during circuit breaker where everyone was a rush and the frenzy, and all the items were gone, and living with families very, very, very expensive rice that the families could not afford. And it's actually also worsened by increased food prices. So a lot of families reported that food prices in NTUC have increased. A few of them also said the closure of shops with cheap options, such as value dollar shops, they were very saddened by it, because value dollar shops are shops where they turn to get cheap groceries. So one of the beneficiaries said that she finds that it's unfair for low-income families that they have to spend so much more money buying the same items from NTUC. 11.1% reported caregiving challenges, the stress increase from caregiving or being at home with children, and also taking care of dependents who have medical issues 24/7. Like Qiyan said, there's also like challenges in engaging children at home who are getting restless and wanting to go out. So there was a lot of stress in trying to manage the kids who are restless, and this can also give rise to certain tensions within the family. And because of that, a lot of them actually get the child to be engaged using mobile devices, and there's a dependence on mobile devices to keep the children engaged during the period, which not sure whether it's going to be beneficial for the kid in the long run. So there are also other interesting insights from the challenges. Other issues that were reported were home-based. 6.6% reported home-based learning, supporting the kids in home-based learning, and also access to laptops. About postponement of medical appointments for chronic medical issues, which is about 9.2%. The data sets were also quite dynamic, because the data that was collected before circuit breaker period as compared to during circuit breaker period, you see an intensification of issues across all the challenges. So, for example, for finances, and during the pre-circuit breaker period, 17% reported financial challenges, but during the circuit breaker period, 50%, actually half of the respondents said that they face financial challenges. So you can see an intensification of issues during the circuit breaker period. We also did some correlation studies, and there's no correlation between demographic profiles and COVID-19 challenges. What this goes to say is that no matter what demographic, your ethnicity, or whether you're in purchase or rental flat, families are equally likely to be affected by COVID-19. The last one, two interesting insight, is about space in rental housing. So there was this one beneficiary who said that there's actually increased anxiety because there's 7 of them living in a 2-room rental flat, and the place is really cramped. Everyone's really in proximity with one another. So she's scared that if one person gets COVID-19, then the rest of the house will get COVID-19. So I think this raised up the issue about, how cramped spaces actually poses quite a risk of contracting COVID-19 because of the density of the area. So I guess it's something that was quite interesting. And also another insight is the importance of value dollar shops for family. I think value dollar shops are shops that most of us take for granted, but it's really important for families, especially with tight finances. So in terms of assets in community, there was also a question that was asked during the learning conversation. Say your neighbor needs help, the community needs help. Are you willing to step up, come forward and volunteer and contribute? So out of 349 people that we talked to, that we had conversations with, 64.2% actually offered to help. Say, yes, if you ask me to help, or if my neighbor needs help, I'm willing to help and offer to help and contribute to my neighbors. And these are some of the various skills and assets, and we asked them, in what ways would you like to contribute? So these are some of the skills and assets that were discovered in terms of cooking and baking, food delivery, transportation, driving, cleaning services, home repair, maintenance, community leadership. A few of our beneficiaries are themselves leaders for food distribution initiatives in their own neighborhood, arts and crafts, sharing of skills and resources, and about 49.2% said that they didn't really have any specific skills to contribute, but if there's anything that they can help with, or anything that they can contribute, they are willing to come forward and just extend a helping hand to the neighbor or to the community. We also asked about, in terms of community responses, we asked whether they see anything happening in their community and by whom these responses are by. 24.6% of them reported that they see initiatives by organizations, be it hand sanitizers in lifts, or food distribution by the RC or CC during this period. 27.7% actually reported the neighbors looking out for one another, be it in terms of sharing groceries, sharing food rations, or buying food for the elderly, or buying food for those who are on stay-home notice, and even updating elderly about the recent news, since they might not have access to the recent news. 45.8% of them said that nothing is actually happening in their own neighborhood, in their community neighborhood. So a question asked about sources of support. Who do you turn to for support during this period? 35% said they turn to family for help. 7.1% 30.2% they turn to friends. 30.9% said they turn to organizations, which also include SSO, FSCs, and other community organizations looking to help. While 60.3% said that they had no one to turn to for support. Yeah, so this in terms of assets and community. So what I'll be going through now is the responses from the community and also the agency that came as a result of discovering this information from the learning conversations. First one is a COVID-19 no sweat hand sanitizer initiative. So during the pre-circuit breaker period, the most prominent challenge that was faced by beneficiaries during that time was a lack of access to hand sanitizers or masks. And during that period, a lot of the hand sanitizers were out of stock, or if they were in stock, they were at very exorbitant prices, and this is something that some families could not afford. So in terms of in line of providing and hand sanitizer is actually a very basic need in times of a pandemic, because it helps to reduce transmission of the virus. So this COVID-19 no sweat hand sanitizer initiative is an initiative where there were actually contributions from the community of hand sanitizers, and beneficiaries who actually came forward and actually during the learning conversation saying that they wanted to help the community. They were mobilized to the beneficiaries were mobilized to place hand sanitizers in the lifts of the neighborhood and the community, and also maintain the hand sanitizers. So the beneficiaries like the eyes and ears on the ground, and helping the community to maintain the hand sanitizers in the lifts. Another one was Project Goodwill Raya cookies. If you remember, during the circuit breaker period, it coincided with the Hari Raya period, and because it was during circuit breaker period, a lot of the normative, Hari Raya celebrations or visiting the festivity has had to be stopped, because visiting is not allowed, and contact is not allowed in the community. And a lot of beneficiaries who do home-based businesses, baking cookies, actually depend on the Raya period to get some extra income for their families by baking cookies and selling them to families. And I've also sat in a few conversations with beneficiaries saying that how are they going to celebrate their Hari Raya this year? They say they will just do something simple, because they can't really afford Raya cookies anyway, so they will just have something simple. So because of this situation, the idea of Project Goodwill Raya Cookies came about. So it's actually the idea of bringing the Hari Raya celebration to low-income families by sending them cookies that were actually contributed by the community. So remember, during the learning conversations, we found a few beneficiaries who are doing home-based businesses. We engaged four beneficiaries who came forward to say that they want to offer and actually bake for the community. So we engaged the home-based bakers. And they consolidated all the cookies, of course, through safe means, contactless means. So you have a question of how actually are these cookies delivered to the beneficiaries and families. We also had beneficiaries who are actually doing food delivery services. They are with GrabFood or Foodpanda, so they are essential workers during this period. We engage them so that they can also send these Raya cookies to the families to bring, symbolically, a celebration of Hari Raya together with the community. These community responses have also spun off to different community groups. So right now there's also a collective or delivery riders who still continue to send items to families who are immobile, who are on stay home notice, and they can't go out of the house and need items to be delivered to the community. And another one is also this Saturday, in terms of Deepavali, there's also Project Goodwill Deepavali to I think continue this spirit of goodwill. So it's the same people and also new people who's coming to the group to do something for the community in celebration together. So based on the findings and also the experiences of responding to the needs that were actually surfaced, or the needs and also the assets and resources that were discovered through the learning conversations, there are a few key reflections that's worth pondering upon. So the first thing is that in times of crisis, formal and bigger systems could take some time to respond. And if people find out about the resources and go to the formal systems, they might be overwhelmed with a lot of requests. So community agencies being very close to the ground, having access, community agencies have access to knowledge of what's happening on the ground as they are the closest, and there's room to be flexible and nimble about about responding adaptively to what's surfacing through the learning conversations in terms of challenges. So for the agency, through the learning conversations, there was also identification and response to the areas of emergent needs from the conversations. The first one is the access to the hand sanitizers, which was responded with the hand sanitizer initiative. The second one was in terms of financial challenges. We had an internal family support fund where social workers can use the fund to plug the gaps of any gaps the families is not that is not covered by any current initiative, to support the family to try to tide through during this period. In terms of digital access for home-based learning, the agency also gathered donations of laptops from various sources, from personal donors, from organizations to be bridged to the family so that they can so the children can have home-based learning. To address the idea of food insecurity, the agency also leveraged on the Pili Pili initiative, which is actually a fresh food distribution initiative to the families. And we adapted flexibly by changing a food distribution program into a collaboration with a local mini-mart to provide vouchers to low-income families. And the families can actually go to the mini-mart. The mini-mart has, a variety of fresh food and also frozen food and groceries that the families can also access. So, and this is, and the identification of all these challenges come from the proactive stance of making efforts to understand the situation during the period as experts of their own life, and being able to adapt, being nimble, flexible to adapt accordingly to bridge resources to families. The second key reflection is about rethinking roles of social service practitioners. As evident from the findings from learning conversations, families lack buffer and resources in tiding through this COVID-19 crisis. So this is a message that that reinforces whatever Qiyan has presented about building buffers. So we're thinking about is the gatekeeping role being highly stringent with documents and assistance, giving just in time, just enough assistance for families? Is it necessarily effective in helping families to build a buffer to tide through crisis? Or can we explore a more enabling approach in working beneficiaries where assets can be built and buffers can also be built so that families do not just survive, but they also thrive? And for social workers, there's also a role for advocacy. You understand from learning conversations what the beneficiaries are experiencing. So is there a role for advocacy as well? The question to think here is about how can social safeguards be built so that the vulnerable can have buffer, especially during hard hit times. The third learning point, reflection point, is about rethinking community work from the experience of having beneficiaries, community members stepping up, and even when times are difficult, it's really quite heartening. And I think it also challenges the predominant view of community work. Is community work just about working with partner organizations? Is it just about doing outreach? Or can more spaces be created where beneficiaries or community members can feel empowered to step up and contribute to their own community and help each other as well? So when someone comes to you for help, it's not just about challenges that you want to discover, but also assets, because discovering the assets and strengths invite a lot of possibilities where they can contribute to the community. And there's this one quote by one of our beneficiaries saying that, "I never knew that there are opportunities for us to contribute. We get help, but we don't know that we ourselves can contribute to help the community." So when my social worker approached me to ask if I'm interested to contribute, I said, why not? So this is a quote from one of the beneficiaries who was involved in the project Goodwill Raya Cookie. So she was one of the bakers, home-based bakers. So the question to think here is, how can genuine invitational spaces where community can feel empowered to contribute and support each other be created? Yeah. So just I'm wrapping up the PowerPoint. So right now we are at the crossroads. Right now we are probably reverting back to hopefully pre-COVID-19 times, where the cases have gone down and we are starting to open up a bit and loosen up the restrictions. So the question for ourselves is, from all the key reflections learned from the experience, would we want to establish new norms where we can work with beneficiaries in a more enabling manner, where they do not just survive? I mean, beneficiaries' families do not just survive, but they also thrive, and also spaces where beneficiaries can come forward and contribute. Can they also be created? Can we create these new norms, or do we want to go back? Or do we want to just do away with some of the lessons that COVID-19 has imparted with us through this experience and go back to our old ways of working with beneficiaries? So I think it's just a question for all of us to ask ourselves as practitioners, as a sector. Yeah, so it's just something to like a food for thought for you to go home and I think reflect about. Yeah. So, I mean, before I end, I would also like to give acknowledgements to the following team for the analysis and for mobilization of the staff and volunteers during the learning conversations. Yeah, thank you.
Thank you, Adriana. And we are supposed to end at 5:30. We have 5 minutes, but we have got a few questions. Since Adriana has just completed her presentation, I will take that question for her first. There were about 2 or 3 questions asking about the respondents commenting that the ComCare support was reduced during the COVID-19 period. Was there any specific reasons for this in your conversations with the beneficiary?
There wasn't in the conversation, because the conversations was really a very generic conversation. It was just, we don't really know what's the cause for reduction in ComCare. So it could be due to a change in family circumstances or income, but due to the very volatile nature of COVID-19, where jobs can just be lost and changes in income can just be lost in a blink of a time, can also systems be responsive enough to the changes in income that's happening in the families to meet the immediate needs of the families. Yeah, so I guess that would be my response to that question. Yeah.
I also read on the Q&A box that there is a comment saying that there was a auto extension of ComCare assistance to the families who need it. So maybe that was a factor that we could have considered as well, that the assistance that was needed for those who are receiving ComCare was actually extended for them. Okay, then the next question for Qiyan. Did you collect data on rates of family violence prior to circuit breaker? If there isn't comparison data, then how is the conclusion drawn that there is a spike during the pandemic?
Yeah, okay. So I don't have data before the circuit breaker. So part of the inference was from data from other agencies, like where, for example, they recorded a high spike in the phone calls asking for help about family violence. But this is also pertaining to the drop from circuit breaker period to post circuit breaker period. There was a huge fall in the family violence rate, and it remained stable over the next few weeks until July. Yeah, so there are good reasons to suspect that there was a spike during the circuit breaker period. We also asked some for feedback from the contributors. What were the challenges at work in our data collection, and family violence was cited as one of the main challenges during circuit breaker period. Okay, so these are the various pieces of information corroborate and led me to that point. Yeah.
Okay. We have a question for both Adriana and Qiyan. What are your thoughts on how we could build a buffer for vulnerable families? And actually, this is on my mind as well, in anticipation of a future disruption. Would it be the role of community agencies to fill that gap more? And if yes, how? Or can formal agencies step in to do more to allow for that to happen? And this may refer a little bit to what Qiyan mentioned about the social insurance option. So this is open for both speakers to comment. What are your thoughts on how we could build a buffer for vulnerable families?
Adriana, you want to?
You can start first, and I will support you. Yep.
Okay. So maybe you will be in a better position to comment on the role of community agencies on this. Okay, so building a buffer is very necessary if you do not have social protections in place. Okay, so if during a crisis I have to rely mostly on myself, then of course I need to build a buffer. Okay, so that's the difference. If not, in countries where social protection is strong, then basically the state is building the buffer for you in a sense. Okay, so when something happens, you are still assured of having some income, and that is the kind of buffer, not in your bank account but outside your bank account. Okay, so those both are buffers. So in our system, families have to build their own buffer, but whether or not they can build a buffer actually has a very mechanical relationship with their income. So if they have very low income, then their priority should be to make sure that they feed themselves well, have enough nutrition so that they can go to work, so that they can continue to take care of their family members. And it shouldn't be about building buffer in that sense, because buffer is for something that is long term, whereas the present, which is taking care of your health, actually it will reap more benefits than having savings in that sense. Yeah. Having said that, my presentation shows that social service agencies do see the need to help families, so they came in very strongly to help. I take Kampek's point about the extension of ComCare. Actually, when that happens, it coincided with the last week of our infographic, and we specifically hooray on this great news on our Facebook post. Okay, so I encourage everybody to see that. Yeah, so that was so critical. And we were also, I mean, when I was doing the presentation, sorry, I didn't have time, but I was very heartened to see that many families who, I mean, despite a smaller portion, many families who exceeded PCI of 450 do get government assistance. Yeah, so however, it remains the fact that there is a lot of uncertainty involved, whether you'll get it, whether you need to be very hardly hit by the pandemic before you will get it, whether you have to lose most of your things before you get it. Okay, so this remains a huge uncertainty. Yeah. So Adriana?
Maybe I can comment on the role of community agency. So I'm just speak on I think AMKFSC. So within AMKFSC, there's this initiative called a Family Support Fund. So this is a fund where social workers are able to tap on to in order to plug the gaps when they work with the beneficiaries. And the beauty of this fund is that social workers are able to use it creatively based on what would actually help the families. So for example, if the families have certain aspirations or goals or things that they require support in or require maybe sponsorship, this fund can actually be tapped on to sort of like support families like in a more, I think, aspirational, more developmental manner. I think maybe also if I also take an example of other, I think more buffer building initiatives by community agency, will be the MWS FDP, the asset building and I think debts and saving matching scheme. Yeah, so I've had social worker colleagues who said that they have managed to get families to save 7K to 8K while being on the initiative. So I think more initiatives like this, asset building initiative that allow families to build savings, to build buffers, to touch during this period is very important, and more of it should be done. Yeah, to work with families in a more enabling manner.
Maybe we will take one last question. It's addressed to Adriana, I think, but I'm sure it came out in Qiyan's study with in the data bank as well. The question is about digital access during circuit breaker, home-based learning. How does the effort of AMKFSC or actually any of the social service agency dovetail with those of schools, MOE? How do we complement the ministry in providing that support? What else must we do to ensure that nobody falls through the gap?
So maybe from at that point in time during when we had the learning conversations, we're having conversation with family. The family said that, you can borrow. I can borrow laptop from school, but the school has run out of laptops to loan out. So where can I find a laptop to to allow my kid to have HBL? So I think it's about being community agency, you're able to respond more nimbly and I think flexibly in response to an immediate and urgent need, like for HBL, because HBL was happening in the following week. So we had to, I think, find some digital access to meet the immediate, because I think bigger systems might take some time to respond. So laptops were actually gathered before MOE had the initiative to actually ensure that the initiative to say that all students will actually be equipped with a laptop or learning device to support home-based learning. So I think the question here is about responsiveness and being close to the ground. Community agencies are in a position where you can respond almost immediately to a family, so the families don't have to wait and have their children's education be affected because of the lack of access to laptop in an immediate way. Yeah, so I think that's where we are coming from. But that again, I think it's also important to synergize the efforts so that we don't duplicate efforts and And so it's about timeliness of having that need met during that particular time. Yeah.
Thank you, Adriana. Qiyan, any comments from you?
Yeah, I pretty much agree with Adriana on the point about responsiveness. So I guess nobody would have anticipated that, you know, we would need a large number of laptops to be distributed. Definitely not MOE. So, you know, so how are they going to distribute all at one go, you know, in a really timely fashion and many machines at the same time? But having said that, I think the more important question that we have to ask is what were these families like before circuit breaker, before the need to do home-based learning shows up? Many of these children from poorer families may have no access to a digital device, except for maybe their parents' handphone. Yeah, but they were not using laptops. They were not learning how to use laptops, for example, typing, which are actually very important for our next generation since we are going digital full way, see? So yeah, so what happened, what caused this gap in terms of insights is important to examine, I think, from policy perspective. And how do we continue to ensure that the low-income households are plugged in digitally? Okay, they are not left behind by all this digital progress that we are making, and so that their children will be able to be, you know, to take on jobs that involve digital technologies. Yeah, so this is very important for ensuring social mobility going forward.
Yeah, agree with both speakers. And actually in touch, we have the same problem with our own families, and we realized that the digital piece was a very big piece, and we are actually glad to observe that over the 2-3 months that evolved, including MOE and the other ministries, we all stepped up to ensure that digital inclusivity was actually put in place quite quickly. So that is a real thumbs up to all who made it happen. I know I said that was the last question, but then many questions are coming in. I will attempt one. Okay, Robin, if you are listening, we will do one last one to just wrap up the discussion, because there are a few questions on then what should the future of social service delivery be like after circuit breaker? How do we move forward from here?
Adriana?
Okay, I'm actually also looking through the Q&A segment, and I see a certain comment that I very agree with. So I think it's something about how can we rethink the way we see financial assistance in a more investing in the future of the families and more preventive way, rather than remedial ways when families are already down and out. So how can we focus more on developmental aspect of investing in families' aspirations rather than helping them when they need it? So it's about firefighting. How can we move from firefighting to more aspirational, looking at aspirational families' aspirations to make their lives to make their lives better. Yeah, and also one thing that's also important is about the creating of space for beneficiaries to come on board and contribute, and in the future maybe co-creating initiatives together, because families are they have lived experiences, they know what's happening, they know what's best for themselves, and I think they are also very resourceful and very enterprising in the way they also cope with their own challenges. And how can we also harness that strength, that lived experiences, that expertise to come and co-create initiatives that would be for, like I said, for the collective well-being of the community. Yeah, so I think these are two areas where we can look at how social service can progress.
I absolutely agree with Adriana's point on the slide, where we are experts of our own lives, and we have to help our beneficiaries understand that and see that for themselves. What about Qiyan?
Okay, so about preventive measures. So I guess one of the striking things from the short analysis that I've done, right, is the difference between renters and low-income homeowners. Actually, in terms of income, they are not that different. They are very precarious. However, they have this asset called the house. So, so the question is, should we then treat them very differently? Okay. One possibility that could happen if you look at the lower rates of low income owner households receiving FA, right, is that a household may not receive FA and then end up losing the house. Okay, and then they will end up going to rental, where they will then get the FA. Yeah. So this is this something that is that we want, and whether it is easier for us to prevent them from falling to poverty, or is it easier for us to lift them from renter to owner households? Okay, so I guess the relative ease should inform us whether we should take a more preventive approach or a more remedial approach. Yeah, so I think this is definitely that I think I have seen quite a lot of progress in terms of thinking about this from the SSAs. Very, very encouraging. This is very different from 3 years ago when I did another study with Yu to think about financial assistance, where many social service practitioners were very concerned about gatekeeping versus preventive approach like this. So I think this is a very positive sign. We are going forward, there will be more efforts to do this.
Yeah. So coming from the social service agency myself, I do see that COVID has opened up many opportunities for us to rethink, redo, redesign, so that the impact to our clients can be even greater. So thank you to both speakers, Adriana and Qiyan, and thank you to all the participants for your very active involvement, and your comments have been so fruitful and so meaningful for all of us in this session. I hope you have enjoyed this session. With that, I will have to wrap up the webinar, and I will pass the time back to Robin.
Hello, hi all. We have now come to the end of the SSR COVID-19 webinar series. Thank you for all your questions and your reflections. We are very glad that Adriana, Qiyan, and Anita have kept you all very engaged throughout the session today. There is much interest generated, and our conversations on this topic doesn't need to end here. So if you are an agency that has conducted or is conducting COVID-19 related research, we would like to invite you to present at the SSR seminar series, which we will be restarting in January 2021. So please get in touch with us after this. Once again, we thank you for your participation. Good evening and goodbye.